Here's Delaware Governor Jack Markell's weekly message.
Physical problems have a nasty habit of turning into fiscal problems. Whether it's lost wages for the employee, lost productivity for the employer, or rising bills for treatment that wind up increasing our premiums for everyone, sickness and disease carry a dramatic financial cost. The physical costs can be even more severe. Chronic pain, loss of mobility, susceptibility to depression, which raise the likelihood of more health problems. Chronic diseases like diabetes, hypertension, heart disease, and strokes are among our most expensive conditions to treat. This is no idle exercise. According to a study in November's American Journal of Public Health, it costs $494 billion annually to treat non-institutionalized U.S. adults for those diseases and their complications. Delaware alone spends $800 million on chronic diseases. How do we fight these threats to our physical and financial freedoms? A problem this big requires more than one person to tackle. That's why a number of Delawareans just hit the ground running to search for solutions as part of our new Delaware Council on Health Promotion and Disease Prevention. They're tasked with offering substantive solutions to feed this growing fight. The coordinated effort includes areas economic development, which requires a healthy and active workforce to succeed, agriculture, whose locally grown produce items could be a healthy and economically sound answer to some of the childhood obesity problems, transportation, which can help individuals literally get moving to reduce their risk of chronic disease, and our kids department, which has seen the hard science around the generations of costs that could come from the recent and rapid increase in pediatric obesity. The good news is early work is showing that even small steps can make a big difference. Authors of a recent study project that initially, Delaware could save $33 million a year and eventually $92 million a year if the prevalence of diabetes and hypertension decreased by a mere 5%. Even small steps aren't easy when it comes to combating chronic and preventable illness, but we have a personal responsibility to try in a way that helps restore our financial and physical freedoms and keeps Delaware moving forward.